Today we have little Max in for his desexing procedure. He will firstly undergo a pre-consult with one of our vet liaisons, doing a TPR and recording all important information for the patient today. Following this, our surgical vet, which today is Dr. Christie, will do a full physical examination of Max, checking his heart, lungs, teeth, eyes, and all vital signs, making sure that he is fit and healthy for his surgery today. As Max receives all the cuddles, he will now have a catheter placed into the cephalic vein. He will then be placed onto intravenous fluid therapy. IV fluid therapy plays a big role in a safer procedure and a quicker recovery time for little Max post-surgery. This is a very important part of the procedure, as this gives us intravenous access to the patient and aids in hydration for the patient throughout the surgery. As you can see, Max is very comfortable with our nurses and he is very happy receiving all the love. Lots of pats and lots of cuddles. Now he is placed back into his bed while one of the hospital nurses sets up his IV fluid pump and gets him ready for surgery. It is very crucial that he has the correct IV fluid therapy rate, and it is monitored throughout the day to make sure that he stays at a maintained rate. He is now monitored until he receives his pre-medication before surgery. Here we have our surgical nurse and surgical vet who will liaise with one another to calculate all medications and create an anaesthetic form needed for little Max to undergo his surgery today. Max will now have his pre-medication, and this will make him just a little bit sleepy, so we were able to clip his surgical area. As you can see, Max is just a little bit sleepy now, and he is very content receiving scratches and cuddles while we clip his surgical area. Off we go now into surgery. Don't worry, we definitely won't show you the gory bits. He is now having his induction drug, which will make him even more sleepy so that we can then place an endotracheal tube. This is how our patients stay under anaesthetic and receive oxygen throughout the surgery. After little Max is all stable, we now scrub this surgical site with a surgical scrub. As you can see, Max is now in recovery with one of our lovely nurses being monitored. Once he is fully awake, he now goes off for a little walk outside so he can go to the toilet and enjoy the sunshine. He is very, very happy about doing this, sniffing and making sure that he looks around and has a great time. From here, we go back inside to wait for his family to come pick him up. And as you can see, he is now ready to go home.